Hi everyone, this is Dr. K again. I am coming to you from a rainy, wet day in Bozeman, Montana. Currently at Starbucks hanging out, and I thought I would put together a quick discussion post talk from me because I think this limits the scope of practice is kind of a um, big concept to grasp that really can be explained rather simply. So let's see how this goes. What comes to mind first about the scope of practice is considering whether you see yourself as an educator or a counselor. This is actually a big debate in the profession itself, where ACA would consider you a counselor and ASCA would consider you an educator. And if you ask anyone in the field, we're kind of split on this one. Half would say you're an educator, half would say you're a school counselor. So you're going to have to figure out where you fall in this great debate. I personally see us as counselors who work in an educational setting. So because of our setting, we have a different scope of practice than someone who hangs up their shingle outside at a clinic or an agency or a hospital. We are licensed by state boards of education, not by counseling boards. Counseling boards license clinical counselors, family practice. It's getting really loud out here. And because we are licensed by educational boards, state boards of education, we follow state board of education codes, laws, rules, and our license can be revoked by the state board of education, not by clinical boards. So we don't diagnose, we don't do treatment plans, we follow FERPA, not HIPAA. And the students that we work with have normal developmental issues, things that fall along the lines of normal development. That could be kind of regular anxiety as opposed to generalized anxiety disorder, kids with testing anxiety, kids who are managing divorce, friends, developing leadership skills, things that inhibit their academic growth. We don't do trauma groups, we don't do rehab groups, no depression. Anything that's diagnosable falls outside your scope of practice. But you can work with these students inside the school building to help them manage on a day-to-day basis in the classroom. That's kind of an important part of what we do. So that doesn't mean a student who has OCD or GAD or any of the diagnosable disorders that we have in the DSM-5 you can work with them, but you're not working with them in a clinical manner. You're not coming up with a treatment planning and seeing them every week because you're not trained to do that. You have to have special supervision post-graduation for 3,000 hours. You have to have certain courses in school. So those are types of issues that we refer out. Now, when we are on campus, you have to remember we see kids all day long, 5 days a week. They don't go home. In a clinic, they go home. So we have to manage those frequent flyers, those kids who enjoy the attention and that positive reinforcement that come by a lot. So you have to find ways to encourage autonomy and encourage students not to be coming by all the time, and to find other ways to manage and get their needs met. Which kind of adds to that overwhelming nature of not only are you seeing maybe 10 to 15 students one-on-one to make sure that they're on track and doing well, you have everything else that you have to manage as well. Your 504 meetings, your schedules, parent meetings, everything else on top of seeing 10 to 15 students. And keep in mind, 15 to 20 students in a clinical practice is full-time. That is a full-time job. So if you're seeing 10 to 15 students one-on-one throughout a month or throughout a week, I don't know how you would do it every week, but if you do manage to pull that off, think about how that compares to a clinical counselor and then add everything else you have to do on top of that. So it can be overwhelming. Intake is different because you don't sit down with the student one-on-one and do an intake session like you would in a clinic. Hopefully you'll step back and find out a little bit more about a student before you actually jump right into one-on-one counseling, because that's not always necessary and it's not always your job. Sometimes kids are sent to you for the wrong reasons. I think I've said this in another post. I had kids that were sent to me because the teachers thought I should talk with them about not picking their nose in class. That is not a counseling issue. That could be the nurse or encouraging the teacher to have that discussion. Now, the student, here's how I explain the difference to teachers. I had a student that picked their skin off of their fingers and ate it. And that was more my purview, to figure out whether that student needed to be sent out into the community for some intensive treatment, because that's along the lines of self-mutilation. And it became an issue that that kid also played violin and would bleed on the violin, the school instrument. So there was a difference there. There was some inquiry that needed to be done on my part, and then some checking in about coping skills and making sure everything was, all the needs were getting met at home. So there is definitely, don't jump into every kid that's sent to you is someone you're going to see. There are cumulative records to go through. There are teachers to talk to, parents to contact to find out, is this something that could fit into the 10 to 15 students that you can see. And then we also have a lot of other professionals on campus, teachers, principals, nurses, that we can collaborate with, talk with, and work together with. The biggest issue that I see in this area is don't overlap services. A lot of what school counselors do tends to repeat what teachers have already done. If you're big on behavior plans and sticker charts and all of that, I promise you teachers have done that. They've exhausted their skills and their resources and are sending the students to you to do something different. So you need to be cautious that you are not taking on a teacher's role or a teacher's identity when you work with students. You need to be different. You need to have your attending skills of listening and being present and asking questions, not fixing the problem, not coming up with, we're going to get your planner out every day and have the teacher sign it and put stickers in it. Teachers have already exhausted that. You need to find something else to do with students to create a change, to create an internalized change, not something that externally motivates students to change, like candy. I had a student once that promised her student pie on Friday if they behaved all week. That is not what we do. That's externalizing motivation instead of internalizing it. We strive to understand what it is that is driving a behavior that is keeping them from success by questions and understanding and not judging and compassion. So make sure you don't repeat teachers' roles. That is a huge danger, and when you start doing that, you'll start to see yourself as an educator and a teacher and an obsolete person on campus, because campuses have very many teachers that can do their jobs very well. I've been a teacher. I was a teacher before I was a counselor, and after I was a school counselor, I was a clinical counselor. So I've kind of run the gamut, and there is a very distinct difference between roles. It's best understood when you take each role on individually. So consider where you see your end of your scope of practice when you're working with students, teachers, principals, and everyone. Where do you fall in the mix? So that's it for this week. Good luck. Happy posting. Boy, I hope you can hear this with all the road noise, and there's a little puppy over there. There's the road out there. My daughter is at the high school today taking driver's ed, so I am hanging out waiting for her to finish driver's ed right across the street. That's my day. So I'm going to continue grading and reading your posts, and I look forward to seeing how you define your role as a school counselor differently from a clinical counselor. Have a good day. Have a good week. I will see you soon, hopefully in residency. You'll be joining me soon. I look forward to it. Bye-bye, everybody.